Hello my lovelies, and welcome to today's video. My name's Alya and I'm so glad you stopped by. Today we're talking about a really exciting topic. Today is all about MRI and eyes. You would think that MRIs are reserved for brain issues, but there is such an intricate connection between the brain and the eye, and today we're going to talk all about why sometimes your ophthalmologist might order a brain scan. Hope you can stick around and talk about MRIs with me. This is an exciting video because MRIs are, how do I put this? We don't do them often. They're a rare bird, and it's important to know why you would be sent away from an MRI, because I don't want anyone to panic because they've been sent away from an MRI. So I've got my base on already. If you can see, this is a little bit more of an extra base than I would normally do. I've recently purchased my beautiful Savvy Minerals foundation, concealer, and you guys already know I've got my beautiful powder that I always use. So that's what this look has been done with, and it's just absolutely stunning, if you agree with me. So I'm just going to do the rest of my makeup while I tell you about MRIs and eyes. Let's get the hard to talk part out of the way first, put a bit of lip liner on, and we'll get into it. So I've also got myself a new brush for my eyebrows, so I'm all I feel like a bit of a new woman lately with all these new products. It's very exciting. If you want to see how I apply and what I think about this foundation and how it will wear throughout the day, please do watch later this week. That video will definitely be up after this one. Okay, so let's just say you've been to your ophthalmologist, or it could also be your neurologist if you are seeing one. If you're seeing a neurologist, you've probably understood that there's something deeper going on. If you've been just to the ophthalmologist and you're being sent away for an MRI, that could be a little bit daunting, because why? Some people actually believe the opposite. Some people come in and think that, oh, I need an MRI. You're not going to see anything until you do an MRI or a CT scan, which is a bit more like an X-ray of the brain. The reality is we see most things just by looking at you. We've got beautiful machines like the OCT. We've got fundal cameras, angio OCTs as well these days. These are all machines that take photographs, maps, and even scans of your vessels and the vessel function to tell us what's going on with your nerves, what's going on with every single artery and vein, what's going on with the blood supply, what's going on with the different layers within the retina, of which there are 10. It tells us about your jelly. It tells us about the front section of your eye and can take measurements there. So things like glaucoma can be very accurately diagnosed there. We also do look at different things. You know, sometimes the iris will show up disease. Sometimes the ciliary body, which the iris is attached to, will show up disease. Sometimes just by looking at the retina itself and the vasculature, that will show up disease. Things like high blood pressure events will show up on the retina. Things like diabetes will show up on the retina. You know, there's a lot of things that we don't really have to dig very deep for to know a lot about your eyes, which is awesome because it's so easy just to sit there for 2-3 minutes and have a few scans done. Very intense scans, very specialized machinery, and very sort of fancy machinery, sure, but that's all they do. They take effectively pictures. So from a patient point of view, that's all you're having done, which is really exciting because there's not really, it doesn't hurt. You don't really need much to have them done. I'm even able to do them without drops a lot of the time, not all the time, but quite a lot of the time. And yeah, it's really exciting to sort of be able to do so much research about a person's health in a span of, a couple of minutes. These days in Australia, quite a few optometrists are also able to do these types of tests, which is wonderful. They're not really, depending on who you go to, the interpretation varies. But definitely if they can already do a scan, you can take it further. The sooner somebody looks at the back of your eye, the sooner you end up with a baseline, so a point of comparison, because we're not all the same. Some people are just born with nerves that are just not your standard looking nerve. And there's nothing wrong with that, but it does always make the clinician a little curious of, is there something wrong? And they always sort of need to know a little bit more about, is there something wrong? And that a lot of the time is why we do send off for an MRI. Or a CT scan or further investigation, because the nerve is actually just an extension of the brain. The optic nerve is actually one of the 12 cranial nerves, which is entirely a part of the brain. It travels from the back of the eye, crosses over at the chiasm, which is right about there in the middle, and then travels through these two radiations along the side of the head, and then comes all back together right in the middle where you've got these little sort of sticking out bits at the bottom, your occipital protuberances. Right above that is your occipital lobe. And that's where all vision happens, neurologically speaking, in the brain. So if the ophthalmologist sees that there's something not quite right about your nerve, and they do all the nerve testing in the clinic, and they can't pinpoint what's wrong, and it still looks really, really worrisome to them for whatever reason, because it might be bleeding, or it might be thinning, or it might be appearing to them in a way that is troublesome to your vision or to your eye health, they will need to investigate further. It doesn't mean that this will show anything up. It might just be that that's your nerve and that's just how it is. And that's also fine. There's nothing sort of saying that people can't have strange anatomy. But until it is investigated, they probably won't know. The one thing I would never do is send off a patient for an MRI or other neurological testing before they've done a field test. And this is very important, you guys. A field test is a kind of like a computer game. You sit in a dark room in front of a big sort of satellite dish looking thing, looking through a lens. You have to focus at a little fixation light, whether it be a white or a yellow light, depending on the machine design. And from then on, you're asked to respond to a series of flashes. And the flashes appear at random all over that globe. Now, that sounds pretty straightforward, but actually it's quite difficult because your eye naturally wants to look where there's some sort of stimulus. And the whole point of this test is that you don't look at the stimulus. You really do have to focus on that fixation light and then respond to the flashes. I'm keen, as long as my patient is able, to try that test 2-3 times before I send for an MRI. MRIs can be costly. You know, people might have claustrophobia, might not, like doing MRIs, that sort of thing. And I get it. I recently had to do one for a different reason, and it's okay. Honestly, I didn't find anything about it, but it's a good hour and a half out of your life. And you got to find time for it, and it's expensive. That's the bottom line. It's really expensive. And you don't want to be wasting the resources from access of people who really, really do need it. Especially if you're qualified to have it covered by your insurance or Medicare or whatever the system is in your country. Those resources are often quite tight. So, you don't want to be taking advantage of a system unless you have to. So, yeah, that's my opinion anyway. But if there's something, really troublesome that your ophthalmologist is seeing when they're looking at your many different layers of nerves and vessels and complexes that exist in the back of the eye, and they're saying, hey, this is not quite right, let's do a field test, let's do all the imaging we can, and when that doesn't yield a diagnosis, we've got to look at the brain. The other time we might need to look at an MRI is if, even when nothing is wrong at the back of the eye, just purely by the symptoms. Sometimes we see thyroid variation in the eye because of the way the muscles respond, or we see an anatomy change to the sockets. This is another reason why we might do some brain imaging. I don't think necessarily MRI, tend to do a CT scan for that type of thing, but the good thing about these images is it will tell us where exactly things are going wrong. Is there a mass? Is there a sinus issue? Is there muscle issues? If there's muscle issues, what kind of muscle issues? These are all things that we can diagnose through scanning the back of the eye, which is really exciting. You don't have to do too much to actually get a lot of information. Sometimes eye exams have to extend beyond the actual eye. Sometimes we're actually looking at the sockets around, right, or the anatomy around. Because not only do we have to worry about what actually happens once we look inside the eye, we also have to sometimes assess the pathways getting in there. It also means that the ophthalmic artery, which comes in through the back of the eye, may sometimes need assessment. The other thing I didn't really mention, that field test, I was sort of talking about what happens when you don't yield any kind of anomaly. What if you do? What if something really strange starts to pop up on your field test? Now, as I mentioned earlier, the pathways of the optic nerve are far and wide. It's one of the most widely spread pathways along the brain. So if something is happening inside the brain, like an aneurysm or a little blockage of some sort or a little growth of some sort, they might be completely benign and completely, not dangerous, but you still want to know about them, right? What they might do is they might just clip or press or somehow, get in the way of that pathway to the optic nerve, which means your actual vision will suffer. You will actually have what's called a scotoma, or a missing patch of vision in that representative area. Now, that can't be great, right? The other thing we have to remember is that when nerves become suppressed like that, they often don't recover so well if they've been suppressed for a long time. So if something like that starts to happen, it's much better off just to have it addressed at the time, or as early as possible, even if it's something really simple and really not dangerous. If it's pressing on the eye pathway, it might also be pressing on some adjacent structures, and that can't be great. It really can't be great. So it's a very, very valuable test. A lot of people whinge and moan about it because it's a little bit boring, but that's okay. Boring for 5 minutes. These days it takes like 5 minutes. Boring for 5 minutes is worth it. Really worth it. Most of our tests these days, they're so advanced, like they've been around for so long, at least sort of 11, 12 years, a lot of them. Some of them even longer, some of them more like 30. They keep on getting updated. So the machine we have doing the field test, it was purchased only like 4 years ago, 5 years ago, which is unheard of. Normally these things are 30 years old in the clinics. Ours is new because our previous one decided to have a day and die. So we had to buy a brand new one. And every single year we receive a USB stick with brand new software. So, you know, lights and bulbs and stuff get changed every year as well, you know, except for the actual motherboard, the actual computer, which is not doing too much really. It's a pretty simple program. Yeah, everything else gets upgraded. So, you know, for the most part, we have a 6 to 12 month program when you're there. Like you're always getting the latest and greatest. The same thing is true of the OCT. The actual machine might not change, the actual lens might not change, because we're at the stage now, you can see even phone cameras do a lot of good stuff. So we're at the stage of technology where we don't need to be constantly upgrading the hardware, but the software and the analytics and what those hardware components achieve are constantly being upgraded and constantly being serviced, which means that we're always dealing with, even though the box is the same, the guts are all brand new. So if all of that stuff couldn't analyze what you've got going on, that's where you start to look at imaging and start to see whether there's something a little bit deeper that needs to be investigated, it is what it is. It's unpleasant to be told that, you know, you need some neurological investigations. I get that. But at the same time, it's never done for nothing. Doctors are always hyper aware of the fact that the system might be under strain, or, you know, you might have claustrophobia, or you might have some kind of unpleasant experience there. So they're not going to send you off unless they really feel that there's an urgency or a benefit. A lot of the time these scans do come back saying everything is normal. You know, we found this little thing about you and we found that little thing about you, and that might be indicative of this and that might be indicative of that, but the diagnosis is just this is a human being. A lot of the time that's all it is. But look, when we learn about the internal structures of the face and head, we gain so much knowledge about you. Our medical treatment of you then becomes so much more customized. So it's just a good thing to do if it's necessary. I would encourage, though, that you have exhausted the other avenues of testing first. So if your doctor doesn't have back of the eye imaging, or doesn't have photography in the clinic, or, you know, isn't doing field tests but is sending you straight to an MRI, I would question that. I would say, is there anything else you can do, or maybe a colleague of yours can do first before I'm being sent into a tube? And unless they give you a straight up answer of I'm looking for XYZ and that can only be diagnosed with head imaging, I wouldn't take any other answer. Honestly, they really need to be giving not just you, but also the pathology people who will be doing your MRI a really good explanation as to why. They can't just go, oh, investigation, not good enough. They've got to give them a reason, whether that they be looking for something specific. A lot of the time what we write is actually, you know, change in some of the things I mentioned, sockets, or change on field test, or, you know, suspect for blah, 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 or, you know, had this event, investigation. But you have to have a diagnosis before you can investigate, or at least have a suggested diagnosis before you can investigate, because these things are very difficult to access. They're very expensive machines. They're not the most pleasant. So we just got to make sure we're doing the right thing first. Okay, my lovelies, what do you think about this look and about this makeup? And I hope you've learned a little bit more about why we go and do things like crazy MRIs and things like that. I hope that you're now a little bit more empowered with a bit more knowledge should you ever be sent for one, to make sure that the doctor is doing the right thing by you. I think that these things are a typical situation of knowledge is power. For more everyday stuff and updates about things that are going on in Ida's creation world, please do head over to Instagram. Leave me a comment down below. Tell me what you thought. Don't forget to like, of course. And if you haven't done so already, of course, please do subscribe. I love welcoming new people on this creative journey. So please do go ahead and switch that red button gray. Gray is great. Wherever you are around the world, I hope you're having an amazing day. I hope you're looking after yourselves, and I can't wait to see you on the next one. Bye.